The new year is fast approaching, and you might be thinking of setting some resolutions. Typical resolutions involve giving something up, but focusing on adding something instead could possibly have a bigger impact. Joining us now with some ideas is Dr. Brent Wallis from People's Health. Good morning, Dr. Wallis.
Good morning.
Okay, so it's always kind of hard to set a resolution and keep the resolution throughout the year, but can you tell us what are some good resolutions? Should they be centered around health, fitness?
Health is very important. Actually, physical health is extremely important because it also affects your mental well-being. So I usually tell my patients that it's very important to set goals that can increase your health.
Okay, now what are some of those goals?
So it's very important, first of all, to go see your physician. That's probably the number one on my list, so that they can screen you for any sort of problems you may have and identify issues that can be treated.
So in addition to seeing your physician, what else would you recommend?
Probably exercise. And exercise is usually number one on most people's list. The problem is people don't always follow through with it. So one thing that's really important is to make sure that whatever you decide you're going to do, that you set a very specific and an obtainable goal as well.
Right. You're not going to say, I'm going to work out every single day, for 3 weeks. I mean, you have to kind of space it out a little bit.
Yeah. So something you could do definitely would be to say, okay, every Monday, Wednesday, and Friday, I'm going to walk for 20 minutes in the morning.
Right.
That's a little more obtainable. And if you have kids and you're trying to get them ready for school, there's no way you're going to work out for an hour every morning.
And of course, we know going along with exercise is a healthy diet.
Definitely. And diet is extremely important. That affects all of health. And so probably the most important thing for that is to make sure you eat plenty of fruits and vegetables, watch how much red meat you're eating, just kind of have a generally healthier lifestyle.
Back to the physician's appointments or visits, rather, being preventative is always a good thing. Is it a good idea to maybe schedule these preventative visits around the first of the year so you kind of always remember, I need to get my checkup, my yearly checkup, right?
Definitely. In fact, there's a huge number of people that never go to see their doctor during the year. And so many people have chronic medical illnesses like hypertension, high cholesterol, diabetes, heart disease. So it's really important at the beginning of the year to go see your physician, identify what the plan for that year is going to be, and then set your goals.
Right. And again, it's just a good time of year to kind of get that all knocked out, and then you're done for the year. Go back the year after.
Definitely.
All right, Dr. Wallis, thank you so much for those good tips for New Year's resolutions.
Thank you. Have a good New Year.
Thank you. You too.